In general, the prognosis for stage 4 gastric and GE junction cancers is actually fairly poor still, but MSI high, at least in the current treatment landscape for those that do get access to PD-1 inhibitors or treated with PD-1 inhibitors, is actually vastly improved. But in terms of this data set, looking at comparative analyses of Keynote 62, Keynote 61, Keynote 59, it does appear that if patients don't receive pembrolizumab therapy, that actually the prognosis is still fairly poor. So hence it is very important in terms of these days as an actionable biomarker to look for tumor microsatellite instability. In terms of at least with U.S. regulatory approval, pembrolizumab is the predominant immune checkpoint inhibitor or PD-1 inhibitor that is currently authorized to be prescribed for patients in the United States for, again, if they are found to have tumor microsatellite instability. And actually for those in which they don't have tumor microsatellite instability, it still stands that pembrolizumab can be prescribed as a third-line therapy for those at least that have tumor PD-L1 overexpression by a standard assay. But actually outside of the U.S., in Japan for instance, the regulatory agencies have approved nivolumab, another PD-1 inhibitor, and actually with that there's no specific biomarker requirement in terms of prescribing that therapy, but there is actually other data sets in which it does appear that MSI high also drives high response rates, favorable survival when nivolumab is given in those patients.